Hello everyone, I am Dr. Madanki from CareIVF and I welcome you all again to yet another important discussion. Today I am going to be talking about pelvic inflammatory disease, also known as PID. Pelvic inflammatory disease is an infection of the reproductive organs of a woman. This includes, what do we mean by reproductive organs? This includes the uterus, the ovaries, the cervix, the vagina, and your fallopian tubes. Usually it is an acute infection, but sometimes it may go on to becoming chronic and persist for a long time. Then it is known as chronic PID and may be associated with long-term consequences or sequelae. So, what are the causes of PID or pelvic inflammatory disease? It is usually caused by sexually transmitted infections, also known as STIs, and the main causative organisms are gonorrhea or chlamydia, and sometimes Gardnerella vaginalis and other aerobic and anaerobic organisms may also be implicated. Occasionally, PID may be due to following a miscarriage or a termination of pregnancy, or sometimes even after a procedure such as an insertion of a copper T or an intrauterine device. So, let me explain to you with the help of this simple picture here. This constitutes your reproductive organs. The pear-shaped organ here is the uterus, the cervix, and the vagina. And this is on either side. These are the fallopian tubes and the ovaries. All this is present in the lower part of your abdomen, which is also called as the pelvis, which is why it is defined as or called as a pelvic inflammatory disease or PID. So, how do we identify? There are certain signs and symptoms which help us to identify a pelvic inflammatory disease. The following features may be suggestive of a pelvic inflammatory disease. Pain, which may be acute or chronic. Lower abdominal pain, which may be bilateral, that is on both sides. Or tenderness, it may be an acute pain or it may be a chronic nagging pain. Then deep-seated dyspareunia, that is pain during intercourse. Abnormal vaginal bleeding, it may be intermenstrual bleeding, that is in between your cycles you may have some bleeding or spotting, or it may also be bleeding post-coital, that is after having an intercourse. There may also be, and usually there is also an abnormal discharge which may be yellowish or greenish in color, or even maybe just clear, thick, white like curdish discharge. Also, it may be associated with a foul smell which is purulent. And the signs that we usually see are lower abdominal tenderness, that is tenderness or pain, that is a pain to touch on either side, and it's usually on both sides. There may be tenderness on vaginal examination which your consultant might want to do in order to find out more about the diagnosis. And there is also something called a cervical motion tenderness, that is at the time of an internal examination, he may feel when he or she, your consultant, when he is examining, may feel that when there is movement of the cervix, if there is pain, it is called cervical motion tenderness on bimanual examination. It is also usually associated with high-grade fever. Now, what does it mean? Does it mean that you actually do have pelvic inflammatory disease? This has to be confirmed. The diagnosis may be confounded with other such similar presentations, which may be either due to acute appendicitis or even an ectopic pregnancy, that is a pregnancy which lies outside of the uterus, outside of your womb, in any of the areas within the pelvis. How do we then diagnose pelvic inflammatory disease? Diagnosis and treatment should be usually considered in sexually active young women around the age of 25-30 and who may have had recent exposure of sudden onset of bilateral tenderness, that is tenderness on both sides of the abdomen and tenderness on examination, and in whom we have excluded pregnancy. Then the diagnosis of a pelvic inflammatory disease becomes more important there. So how do we diagnose? How do we confirm? Usually swabs can be taken from the vagina, which are called high vaginal swab, as well as from the cervix to test for infection. It usually takes a few days for the swab results to come back. A positive swab result confirms an infection, whereas a negative swab does not mean that you do not have infection. We can do additionally further tests to exclude infection, such as a CBC or a total count. Your hemoglobin, your white cell parameters may be increased, the neutrophils may be increased, and also CRP, that is C-reactive protein, which is also increased whenever there is any infection. The next test that we can do is an ultrasound of the pelvis, usually by TVS, which also gives us additional information, much more information about the state of the ovaries, the tubes. The tubes are usually not very well delineated in ultrasound. There are additional tests, different tests which we can do to see if the tubes are healthy, which we will come to at a later point during this discussion. And the gold standard is usually laparoscopy. It is used to diagnose PID, or sometimes if there is an abscess, we can even use laparoscopy to drain this abscess. There is something called a differential diagnosis. That is, a consultant, a clinician has to think about what are the other possibilities that may have signs and symptoms which are overlapping with these. So what are the other diagnoses that he or she should think about? An ectopic pregnancy in a sexually active young woman. So the first thing we would do when there is pain, even if there isn't any bleeding, is we should do a pregnancy test to exclude pregnancy. If pregnancy test comes as positive and there is pain, then our first pointer would be towards an ectopic pregnancy, that is when the pregnancy lies outside of your womb. Acute appendicitis may also present with acute onset pain, usually right-sided, but it may be generalized pain as well. Urinary tract infection can also present in a similar way. Ovarian cysts, there are 2 ovaries, one on each side, and they may have several complications which may present with acute abdominal pain, such as an ovarian cyst may have undergone torsion, it may have undergone hemorrhage. So these it may have ruptured. So these are some of the complications that an ovarian cyst may present with. Endometriosis is again one of the very common cause. Endometriotic cyst may also be a cause for the pain. Functional pain, sometimes there is no obvious cause found, but there may be chronic pain, or which may become an acute on chronic, and it is known as functional pain. So what is then the treatment for pelvic inflammatory disease? Since it is an infection of the female reproductive system and usually caused by sexually transmitted infection, it is important to try and identify the organisms which are causative. But having said that, delaying treatment increases the risk of long-term sequelae or long-term consequences such as ectopic pregnancy, infertility, and chronic pelvic pain. We must use broad spectrum antibiotic therapy. What do we mean by broad spectrum? That is an antibiotic which covers most of the organisms that may be causative. To cover which, the Neisseria gonorrhea and Trachomatis, Chlamydia trachomatis, and a variety of aerobic and anaerobic bacteria which are commonly isolated from the upper genital tract in women. So, and we must use a prolonged course of combination or broad spectrum antibiotics to cover most of these organisms. Now, the general advice that we would give to our patients is to be on rest. We advise rest when there is severe disease, appropriate painkillers or analgesia to keep the patient comfortable as much as possible. We may even have to give injectable analgesia. And intravenous antibiotics is recommended in patients with very severe clinical disease such as very high fever, more than 101 or 102 degrees, signs of an abscess or a tubo ovarian abscess. I will come to that a little later. Signs of peritonitis where the abdomen is hard, rigid, very painful, and there are signs and symptoms of the patient having very high fever and the counts being raised. So these are parameters which will make the clinician have a very low threshold for giving a high dose of antibiotics. They should we will advise patients to avoid later on at a later stage, once they get cured from the acute state, is to avoid unprotected intercourse with by the usage of condoms for the safety of themselves as well as their partners till they have undergone complete treatment. Where the signs and symptoms are very severe with very high fever and acute pain, sometimes hospitalization may also be required so that your symptoms, your pain can be monitored. You may be given appropriate analgesia and intravenous antibiotics. If your symptoms are not improving, yes, definitely hospitalization must be done. Tubo ovarian abscess, when the tubes get affected, then there may be a collection of fluid within the fallopian tubes. The mucosa or the lining, the inner lining of the fallopian tube. The inner lining of the fallopian tube has very fine hair called cilia, and they may get damaged because of the infection, and the tubes may also get damaged and leading to a collection of fluid which is called hydrosalpinx, or leading to a collection of pus called pyosalpinx, or there may be complete adhesion of the tubes and the ovaries leading to a formation of an abscess called tubo ovarian abscess. And in that case, sometimes they may need to be drained, and prior to which we may have to give prolonged course of IV antibiotics. So there are certain general points here that need to be discussed. What if the patient has a copper T or an intrauterine device for contraception inserted? Usually, if your symptoms do not come down within a few days of starting treatment and there is a copper T, then we must consider having this removed, okay, so that the treatment can be completed. In the event of having had intercourse in the unprotected intercourse in the last 7 days prior to removal, then we may have to give you additional contraception, hormonal contraception. Should your partner be treated? Yes. Of course, if you have had unprotected intercourse, your partner should also be treated. And if you have had a sexual contact with any other person within the last 6 months, the other person also needs to be treated. The next question would be, when can you resume having intercourse? You should avoid any sexual contact for at least 1 week after having completed the course of antibiotics, so as to prevent reinfection. A very important point to consider is, are there any long-term side effects or sequelae? If there is immediate and appropriate treatment of the acute stage, usually there is no long-term sequelae. But if there is any delay in the treatment, then there may be long-term consequences, which may be mainly affecting the fallopian tube. There may be scarring of the fallopian tube, which may lead to dysfunction. That is, the function of the tube is to allow the sperm and the egg to meet at the time of ovulation when there is intercourse, so that it may assist in the formation of an embryo leading to pregnancy. So this function may be disrupted, leading to a complication known as ectopic pregnancy, when the pregnancy fails, when the embryo fails to come back into the uterus and implant within the uterus, which is its normal place. Difficulty in getting pregnant, again because of the scarring of the tube, because of the dysfunction of the tube. An abscess may form in the fallopian tube or the ovary. There may be collection of fluid called hydrosalpinx, and there may be extensive adhesions, that is, all the pelvic organs inside the pelvis get adhered or stuck to each other very badly, which may cause severe chronic pain. So also known as a chronic pain syndrome, and there may be persistent pelvic pain. Repeated, if these episodes of pelvic inflammation inflammatory problems infections are repeated, then it definitely can lead to infertility. Risk of infection can be reduced by using condoms and ensuring that both of the partners, both of you, have been treated adequately. So there are certain key points. Now coming to the conclusion of this today's topic is the key points that need to be addressed. It is an inflammation of the pelvic organs, the reproductive organs of a woman, which includes the uterus, the ovaries, the fallopian tubes, the cervix and the vagina. Diagnosis is made based on the symptoms, signs, clinical examination and the test results. Treatment should be prompt and adequate. If not, it may lead to long-term sequelae or consequences, and rarely, over and above conservative and medical management, surgical treatment may also be needed. And in order to avoid reinfection, your partner also needs to be treated adequately. The most important point that I would like to mention here from the point of view of infertility is the affliction of and the involvement of the tubes. The tubes can be damaged severely in the event of untreated pelvic infection or long-term infection because of scarring, because of lack of functional viability of the tubes, leading to ectopic pregnancy. So infertility, either primary or secondary, may be the presenting feature because of this infection. Evaluation of the tubes is very important prior to any treatment for infertility, and the evaluation can be done by an HSG, by methods like HSG or hysterosalpingogram, hycosi and or laparoscopy, where we assess the function of the tubes by introducing a dye and seeing whether there is spill of the dye on both sides. This is of prime importance when we counsel the patient and when we give further advice regarding the mode of treatment. I come to the conclusion of my topic discussion here. Pelvic inflammatory disease, once again, I reiterate that needs to be treated promptly, adequately, and of both the partners in order to avoid an acute phase to turn into a chronic one, and more so if infertility needs to be avoided in a sexually active young woman who may be desirous of pregnancy in future. Thank you so much. Hope to see you again soon. Thank you.